All right. Well, welcome everyone, and thank you for joining us for this session three of our fall webinar series. In collaboration with the Hanley Center for Health Leadership and Education and co-sponsored by the Alliance of Maine Health Professionals for Climate Action, PSR Maine is excited to bring you today's session, which is called Health Professionals Leading the Way: How the Healthcare Sector Can Protect Staff and Patients. Today, we'll be exploring how the healthcare sector, one of the largest energy users and carbon emitters in Maine, can take the lead in reducing harmful emissions and protecting the health of those who work in and visit our facilities. We're honored to be joined today by two great presenters. First, Mike Arsnow, who is sustainability manager at MaineHealth, and Katie Liu, med peds trained physician working in adult hospital medicine at Maine Medical Center and a steering committee member of the Alliance. This session will spotlight MaineHealth's sustainability initiatives and challenges and successes of electrification, efforts to reduce the environmental impact of the healthcare system in general, and ways that clinicians and other healthcare professionals can get involved. I'll remind you that CME credits are available for those who complete the evaluation at the end. And with that, I will turn it over to Mike.
Perfect. And can everybody hear me all right?
Mhm.
Awesome. Great. Well, nice to meet you all. I will share my screen and we can do some quick intros and then I'll jump right into content. One second. Everybody gets used to the video platform they're used to. I'm a Teams man myself, so trying to figure out, there we go. Come on, there it is. All right. Hopefully you're seeing two smiling faces. Yes? No?
We don't see your
No, not
slides.
see your slides.
Just one smiling face then.
There you go.
Um, I I know Giselle. Oh, there we go.
Yeah. All right.
Uh,
It's coming.
there we
There
go.
it is.
Perfect. All right. Well, Daniel, thanks for the introduction. So I'm Mike Arsnow. I'm the manager of sustainability for MaineHealth. And Katie will introduce herself a little bit later, I'm sure, when she jumps in. So we're going to tackle how health systems are leading the way in sustainability and how we're partnering together and working together to make our communities the healthiest in America. MaineHealth vision. Actually, Katie, you want to give a really quick how do you do?
Yeah, my name is Katie Liu. I think I know a lot of you here. Like Dan said, I'm an adult hospice in Maine Medical Center. Started doing research and quality improvement work in the area of sustainability and promotion of environmental health about 5, 6 years ago. And it's really wonderful to meet you all. And thank you for having me here to speak today. I also have
Right.
a cold, so hopefully my voice makes it the whole time.
All right. So today's learning objectives, I'll just kind of breeze over this, but we hope that when you leave today, we'll kind of connect you with the climate goals of Maine, give some concrete examples of what's going on in the healthcare system. I'll speak specifically to Maine Health, and although we have Jen on the call, so I'm sure she could chime in with all the great work that Northern Light's doing as well. And then finally, I'll hand it over to Katie, and she'll talk about how health professionals are using their clinical voice to drive climate solutions. All right, so this is where we'll really get into the first learning objective. Understand the role of the healthcare sector in Maine's climate goals. So why healthcare? Why is healthcare sustainability so important? Why do we have to kind of align it with climate goals. So the US healthcare sector, and I'm sure this audience is familiar with this, is responsible for about 8.5% of US greenhouse gas emissions. Um, that is more than the global aviation industry. So it's pretty significant. A fun fact that I like sharing, which I'm sure you've heard, globally, healthcare emits if healthcare were a country, it would be the fifth largest emitter in the world. So it's a large piece to climate change. And why is that? There are a number of reasons. I mean, from the facility standpoint, hospitals operate 24/7, 365. Energy intensive buildings, really strictly regulated air exchange rates, temperatures. Lighting, all of these things all lead to emissions and energy use. We also have anesthetic gases or fluorinated gases, which are unique in a lot of ways to healthcare. Also, major contributors to climate change. Some of those gases are as much as 2,500 times the global warming potential of carbon. So, working on those. And then there's the whole host of what's called scope 3 emissions. So, pharmaceuticals and chemicals, food procurement, the waste we generate. So, emissions in general can be broken into three areas. Scope one, that's what I talked about in the beginning. That's a lot of the fossil fuel burning on site, anesthetic gas use, the fleet of vehicles burning gasoline or diesel. Scope two, that's the electricity that we procure from the grid. Luckily, the grid is getting greener and greener, which I'll talk about later. And then there's scope three, which is all the upstream and the downstream emissions associated with the work that we do in healthcare or any organization. So, the vast majority of healthcare emissions, about 70%, come from that scope three category. So, there's three big buckets to tackle, and most healthcare organizations across the country are really focusing on scope one and two to begin, and then stretching into scope three as well. So those are the major drivers, and that's kind of how healthcare contributes to climate change. So it's also in our best interest to work on climate change because climate change, as said by the Lancet, is the greatest global health threat facing the world in the 21st century. Climate change drives temperature-related deaths, worsens asthma, increases extreme weather injuries, disrupts food systems. Colin spoke last week about how pollution can drive poor cardiovascular health. That was a great presentation. If you didn't see it, I'm sure it's recorded. And I also want to call out vector-borne diseases because we're in the great state of Maine, where Lyme disease is a particular concern here. We have the highest per capita Lyme disease rate in the country. And we're having over 2,000 cases a year. Every year for the last 5 years, we've had a record-breaking number. And that's in large part due to rising temperatures, winters that aren't as cold, ticks that are able to spread further and kind of last through the winter, leading to more vector-borne disease. So all of these things, all of these health effects from climate change directly impact our goal in healthcare, to treat our patients to make our communities healthier. So it's in our best interest as healthcare to work on climate change and on climate goals. So what are the climate goals in Maine? So Maine is very lucky because we have one of the best climate action plans in the state. I mean, in the country. In 2022, the American Planning Association's Resiliency and Sustainability Award was awarded to Maine for the best climate plan in this country. So that's huge. This was built in 2020. And it was really our first effort in Maine to put a concerted focus on climate action. What the climate action plan is doing, and the focus of it is broken into these four goals: reducing greenhouse gas emissions, to strengthen resilience to climate impact, creating jobs, focusing on economic prosperity, and then bringing climate action to all people. And by outlining these goals in the 2020 report, and it's been updated since then, for another 4 years, starting in 2024, this really helps the state and state agencies and healthcare kind of row in the same direction, know what to work on, and work collaboratively across the state. So I'm going to go into some of these goals in a bit more detail next. So Maine's greenhouse gas reduction goal, these are statutory, so they're signed into law. The state of Maine is legally required to hit these goals. So that's a really good driver when you have something that you're legally obligated to do. So these targets are a 45% reduction by 2030 and an 80% reduction by 2050. These targets are based off of 1990 emissions levels, which is pretty common in international climate agreements and things like that. 1990 is a year that often is chosen. And the last report on our progress in the state of Maine was that we reduced about 30% since as of 2021 based off those 1990 levels. So it's great to see that we're making progress and taking steps forward to reduce our greenhouse gas emissions. So the next goal that they focus on is around climate resiliency. So resiliency, the ability to withstand, prepare for, mitigate from climate disasters. That's something that has mattered now more than maybe ever. We're having more frequent and more damaging storms. The number of billion-dollar disasters, sometimes they call that like 100-year storms. It's kind of a misnomer now because the 100-year storms are happening more and more. We had 28 of these in the US in 2023, and that broke the record that was set in 2022. So the number of high intensity storms that are hitting our state and the country is growing. And flooding has really high mortality rates, storm surges that's common in our coastal areas, power outages that impacts people who rely on, whether it's heat or cooling or whatever, and our health systems. So being more resilient is something that the state is prioritizing, and as is the healthcare industry, which we'll get into a little later. And here's just a quick example of those billion-dollar weather climate disasters in 2023. I won't go over all of them, but you can just see how prevalent they are across the country. Economic growth. So economic growth, often when we talk about sustainability, we talk about, well, this is maybe a little outdated, but people, planet, profit, like the triple bottom line. And I say it's outdated just because it's become so trite. People don't often use that people, planet, profit anymore, but it's still true. It's when we can find ways to grow the economy and better protect our environment, that's really that win-win, and also support the people, win-win-win. So the economic growth was a key part to Maine's climate action plan. We have a really natural resource-based economy in a lot of ways. Forestry, fishing, tourism, agriculture, these are very vulnerable to climate change. Ski industry as well, but there also are opportunity as well. So because we have such a strong forestry industry, there are new companies, new organizations coming to Maine, looking at what we can do with wood pulp or things that might have been thrown out in the past. How can we turn that into clean fuels and things like that? There's actually a really um, hopefully high impact project being developed up in Millinocket related to pyrolysis fuels. So taking scrap wood that would have just released its carbon in the forest, harvesting it and turning it into like a fuel oil to be used for heating, etc. Maine has the most heating oil buildings in the country. So we have a really per capita. So fuel oil is definitely an area that we need to adapt and work on in Maine. So then the last focus is climate action to all. So climate action to all, that's all about equity. Um, Climate change disproportionately harms the most vulnerable populations, low income, children, elderly, peoples of color. Like these are the areas that are most harmed, but often don't have a voice at the table. So there's been a specific work group in the climate action plan focused on equity. There's an equity subgroup that focuses on outreach, on communication, on spreading the work that the climate action plan is doing, and then also collecting input so that they can work on each strategy within the climate action plan so that it benefits these vulnerable populations. Um, yeah, partnering directly with municipalities, tribes to implement climate projects that are going to benefit them. So it's not just, seen for a certain, so the benefits aren't just seen for a certain part of Maine, it's seen across all Mainers. So now that I've covered the goals, I want to get into some real world examples. And I'm going to start by going over the 7 strategies that Maine Won't Wait Climate Action Plan has articulated and how, again, MaineHealth biased over here, but how MaineHealth is working on these strategies and how we're helping advance the strategies and the goals of Maine. So the 7 strategies, I won't read them all, but basically the plan lays out how you can utilize clean transportation, efficient buildings, economic opportunity, things like that to advance our goals. And so the first area I'm going to talk about, and I won't get into every strategy, is how MaineHealth is advancing strategy A. So MaineHealth has partnered with Metro Breeze, or sorry, with Metro, the bus line in much of the greater Portland area, to provide free transportation for all of its care team members via the bus. So bus is a great way to reduce emissions, also to reduce congestion, to reduce pollution. So that's one way that MaineHealth is advancing that. And transportation is almost 50% of the emissions in the state of Maine. Maine is a very rural state, so doing things like this, focusing on the future of transportation and clean transportation is key. MaineHealth also has 41 electric vehicle chargers that they provide for free for their staff and their visitors who are coming to the hospitals. It's part of our goal to make driving an electric vehicle easier, to make it easier for our care team members, and thus we don't charge for our care team members to use the electric vehicle chargers on our campuses. Another pretty interesting area that 2 pretty different departments are working on, but it comes to the same outcome is GPS optimization. So everybody knows nowadays you plug in your address and you hit go and you follow the GPS. So for our supply chain fleet of vehicles delivering supplies to hospitals and outpatient practices, they've implemented a fuel economized GPS platform where the route that it takes will provide an optimal route that reduces fuel consumption. And all this data is now like being accumulated, and we can see the collective impact of 100 vehicles with optimized GPS that has a real impact. Another area is healthcare at home. So Maine Healthcare at Home provides care to people across the state. So again, we're a very rural state, so they're driving all the time. Um, by implementing a fleet optimized GPS algorithm to their Epic to their medical charts and to their medical care routing, they are able to most effectively get from patient to patient, traveling the least amount of miles and with the least amount of fuel possible. So these are just 3 ways that we're trying to embrace the future of transportation in Maine. I didn't list it, but I also want to call out because Katie's on the call and she knows it better than any. The MaineHealth Medical Group is also embracing telehealth. So telehealth, that's a almost a zero emissions way of providing care to patients. And the medical group under Katie's leadership is working on a telehealth dashboard to show the impact of the emissions impact of telehealth. So we're excited for that project to be getting kicked off. All right, so modernizing Maine's buildings. So buildings are often, in most areas, most states, buildings are the primary form of, or primary source of emissions. That's not the case in Maine, but most areas it is, and that's because of heating, cooling, lighting, all very energy intensive. So what are we doing at MaineHealth? So we have, I'll start with over the last 2 years, we've implemented over 77 energy efficiency projects in partnership with Efficiency Maine and New Hampshire Saves, because we have locations in New Hampshire as well. And those have, again, back to that triple bottom line, have really been a great way to save money on reduced utility costs, but also saving greenhouse gas emissions. In the upper left-hand corner, you'll see the Cologne family tower. So the Cologne family tower and the Malone family tower, I'll just speak to those two briefly. Those are two areas in Portland that were just LEED certified, and the Malone family tower is actually LEED Gold certified. So that's just going to show that we're using 15 to 20% less energy than required by code, and the Portland codes are pretty strict, and a number of other things. On-site rooftop gardens to reduce runoff, and just create a better holistic healing space. So the last one I'll talk about is greenhouse gas emissions from anesthetic gases. So I mentioned fluorinated gases. So MaineHealth has now converted all of our, and I know Jen has done this at Northern Light too, all of our piped nitrous oxide to small, more efficient E-cylinders, and we've eliminated the use of the most harmful anesthetic gas, desflurane, most harmful to the environment, desflurane. And doing all of those things, we've implemented projects that have reduced emissions by over 3,200 tons of CO2 since 2023. For context, that's almost like planting 5 Central Parks worth of trees. That's the carbon that is being absorbed by 5 Central Parks worth of trees, just through these energy efficiency projects that we've done. So I know I'm maybe getting a little bit long-winded, so I'll try to wrap things up quickly. But transition to clean energy, MaineHealth is invested in 9 solar fields across the state of Maine. Those solar fields are plowing that energy right back into the grid. So Maine has set these statutory goals to green the grid. It's called the Renewable Portfolio Standard, to make a certain percentage of the portfolio. I believe it's 80% by 2030 and 100% by 2050. So Maine has written into law that the grid needs to be 80% renewable by 2030. So MaineHealth is helping to advance that. We've produced over 95 million kilowatt hours of electricity, green, clean electricity for the state of Maine. That's equivalent to removing 107 million miles of car miles through this clean electricity. So we're really trying to do our part there. We also are working on resiliency. Resiliency is key to any healthcare institution. Here you can see mitigation, preparedness, recovery, response. These are the 4 stages that are outlined in the climate resiliency for healthcare reporting tools. So resiliency has been at the forefront of our emergency management team, our system-wide emergency management team, and they're working strongly across the state with local fire, police, etc., other healthcare systems like Northern Light, like Central Maine Medical Center, to create a better and more secure place, infrastructure to support healthcare delivery in Maine. And then finally, I'll talk about so engaging Maine people on climate action. So this is really how the MaineHealth Sustainability Program got its start. We had people who were passionate about sustainability and wanted to do something, and they were working on it. And their work, their progress, their enthusiasm is what helped inspire my role to be formed. And now it's gone from just a informal volunteer focus to a strategic plan item that we're investing well over six figures in each year. So the sustainability network and sustainability committees are something we've developed across this, our MaineHealth hospitals. So you can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. We have our sustainability, or sorry, that was 8, sustainability committees across the state. Um, and it's really an opportunity for our care team members to learn, to engage with events. We put on events, webinars. We had a nationally known speaker on healthcare sustainability speak yesterday to our sustainability network, in-person events. So we really try to provide the opportunity for people to meet and learn, and then also just be more environmentally sustainable at home and at work. We have a lot of resources on our internal web pages that help people with simple checklists on how they can better align their values with the environment. So we're definitely working on engaging with our people on climate action. So that's my last slide. So I'm going to hand it over now to Katie to identify ways that clinicians and hospital staff can support institutional climate action. And Katie, you can just give me the old next slide and
Thanks.
I'll.
That's what I was going to ask. Um, all right. Go ahead and next slide. So, like I mentioned, for the past 5, 6 years, I have been lecturing, doing research and quality improvement on ways that generally physicians, but this can be expanded to clinicians, and all care team members can promote environmental health within the roles they already have. Advocacy is really potent, is really important. That's part of why we're here today. But an argument that I would make to you is that you already are doing climate work in your professional career, in your job, and roles that you have at work and in other places. What you see here is a Venn diagram. This was created by Dr. Ayanna Elizabeth Johnson. She is a marine biologist and a climate activist. She has an amazing TED Talk from which I borrowed this, and I would encourage you all to go find it after this and watch it. She is also a professor currently at Bowdoin College here in Maine. So she has given talks in Maine and um, yeah, this and came up to us because we are the way life should be and doing her great climate work here. Her Venn diagram acknowledges that we all wear a lot of hats. And I think this speaks really well to clinicians because we are used to that. We all fill multiple roles. um, it can be really overwhelming to add more on top of that. And one of the things that we found, me and my frequent collaborator, Dr. Leslie Gordon, have found in our research, looking at the attitudes and perspectives of hospital medicine physicians and others regarding how to bring environmental health into their work, is that they feel like they're already being torn many different ways. So with this Venn diagram, and I hope over the next 20 minutes or so that you can sketch out what your climate action is using this framework. But think a little bit about what you're good at, your skills, your resources, your networks, where you work, what roles you already have, whether it's a committee role, purchasing role, having a voice on the budget, things like that. What brings you joy? What would make you happy? What like you would give you energy to continue working on? And then the last piece, what work needs doing, and that's our job, both Mike's job and my job through this talk is to show you some of the work that needs to be done to decarbonize healthcare, to lower the environmental impact of healthcare. And then somewhere where those all come together for you, hopefully there's a climate action that you can add to the work you're already doing, because that's an action you're going to be able to sustain. Next slide. I just tried to change it. Moreover, to keep it really simple, if you remember nothing else from all the examples I'm about to go over, we as clinicians, we in healthcare make a meaningful impact when we can defer travel, when we can use less stuff and hit next while maintaining quality. And this last part is important. I typically have a slide in my talk that I omitted today, showing that nationally or internationally, um, while the quality of care increases, we use more electricity, we generate more carbon emissions per person, and it levels off at a point. The United States uses much, much more carbon emissions per patient cared for than countries such as Portugal and France. And so we have a lot of capacity to lower the amount of greenhouse gases that we are producing as a US healthcare sector and still maintain high quality care. You can hit next. This is a framework that I've developed and together with Dr. Leslie Gordon, my frequent collaborator, and usually provides the structure for our talks. Thinking about the clinical and non-clinical roles that clinicians can hold, typically hold, and looking at ways within those different roles that we can add an acknowledgement and a promotion of environmental health, of lowering our environmental impact into care. So we're going to go through the hit next. I have a lot of animations, Mike, sorry. We're going to go through that clinical bucket. We're going to go through that non-clinical bucket, and we're going to just look at, they're going to be mostly two-slide pairs. The first slide will be hopefully proving to you that there is value in this as a strategy, high value care, carbon conscious prescribing, telehealth expansion, etc. And then the second slide will be a MaineHealth specific example. Some of it's my work, some of it's colleagues' works and others. But I want to just kind of give you guys some ideas of the kind of work that's going on that clinicians are doing within their current roles at MaineHealth to promote environmental health. So you can hit the next one. So first of all, clinical action one, promoting high value care. What is high value care? High value care, another way to say that is the avoidance of low value care. So one common definition of low value care is care that is of little or no benefit to the patient, such as unnecessary tests or procedures. Next. That gets us, kind of close to a definition of waste, right? Like it's of no benefit, maybe that's waste. So what's a definition of waste? This is from the IHI. And it states, apologies, my voice. It states that waste is activities that do not add value for the patient, family, or community. Um, I might need to step away just one moment to take a sip of water. One second, one second. Oh my gosh, I apologize for that. Does not add value for the patient, the family, or the community. And in some cases, they acknowledge that this non-value added waste can even harm patients and add further costs. Hit next again. So choosing wisely, Canada, which is the Canadian version of the American Board of Internal Medicine's Choosing Wisely campaign. Most people here who work in clinical settings, especially physicians and APPs, will know of this campaign. It seeks to promote the reduction of unnecessary tests and treatment, aka the promotion of high value care, avoidance of low value care, that expose patients to potential harm and consume resources. Choosing Wisely Canada has brought the climate crisis into their mission statement, stating unnecessary deaths and treatments that expose patients to potential harm, consume resources, and contribute to the climate crisis. So in the promotion of high value care, we're looking at using as few resources as possible to provide the highest quality care to patients and avoid harm, not only to patients, but also to the planet. Next slide, please. An example of this at MaineHealth, this is work done by Dr. Leslie Gordon, who I've mentioned previously. I also throughout this talk have highlighted the learners that have been involved in these projects. Dr. Gordon and Dr. Camille Ezrin, who was a resident at the time, seized on the opportunity in June and July of 2024 when BD Diagnostics announced that they were anticipating shortages in the supply of their blood culture bottles. What I heard anecdotally from people who are closer to the communication with the companies is that that shortage came out of a lack of the specialized plastic caps that are on top of the glass bottles, because, especially as you imagine for an anaerobic bottle, no oxygen can get through. So the top of those bottles, the plastic caps, need to be very specially made, and that's what the shortage was coming from. MaineHealth responded to this potential and then actual shortage by implementing a diagnostic stewardship educational program and several interventions, including through the EMR, targeting among many things, the timing of repeat blood cultures and the appropriateness of repeat blood cultures. The publication team here, including Dr. Camille Ezrin, and many other people you may know, Christina Yen, who's listed there, is our medical director of antimicrobial stewardship for the MaineHealth Southern region. So that team together, antimicrobial stewardship medical director, the pharmacist, other infectious disease physicians, looked at the change in the appropriateness and the volume of blood cultures that were being repeated for in this figure, antimicrobial species, bacteria that for which the vast majority of the time repeat blood culture bottles are not indicated, and looked at how the shortage and the interventions around the shortage lowered both the diagnostic waste and I put the quote up there, but a sentence in their conclusion also acknowledged the environmental waste. So there they said 114 kilograms of carbon equivalents would be saved yearly, the equivalent of 291 miles driven, through the prevention of the disposal of these unnecessary blood culture sets. And so again, high value care, right? Like the repeated blood culture bottles for these organisms are not indicated. They do not add to the value of care, and yet they generate waste. They also generate financial waste, and I believe it was somewhere between $50,000 and $100,000 that they felt were avoided by the appropriately using repeat cultures, the appropriate diagnostic stewardship. You can go to the next one. Oh, and that's just highlighting there. Actually, pause for a minute. So the colors are unfortunately very close, but what I just highlighted at the bottom there, those low percentages, 5.9%, 4.8%, that was the percentage that they found to be appropriately ordered. So this is something that we do particularly poorly as inpatient physicians in general. All right, carbon conscious prescribing, clinical action number 2. So this is an evolving area because it's something we can't make decisions on as clinicians if we don't have the information. One area where we know that 2 treatments, which are probably otherwise clinically equivalent, and there's a lot of population selection and things that go into that, but two treatments, metered dose inhalers, which contain HFA or hydrofluoroalkane, that is a fluorinated hydrocarbon, similar to the anesthetic gases mentioned by Mike at the beginning of the talk, versus dry powder inhalers in all their forms, Respimat, Ellipta, Discus, all those different delivery device forms. Hit next twice. Metered dose inhalers have a particularly large carbon footprint. It's been estimated that 1 puff of an albuterol inhaler is roughly equivalent to driving a mile in a car. This is because they contain the gases, so the carbon footprint is due to the release at the use phase and also end of life because they leak forever even when they're empty of medication. You'll see very little of that carbon footprint is due to the manufacturing. There are areas where we're starting to know more and more about the relative environmental impact of different therapies. The UK has been a leader in this. That information is probably to a degree extrapolatable here, but it's not quite the same because their supply chain is different. Antibiotics are another place. University, it's not in this talk, but UCLA has just put out a calculator for antimicrobial stewardship teams to use to compare the environmental impact of plastic waste and carbon footprint of IV versus oral antibiotic therapies. You can go to the next slide. So knowing that metered dose inhalers have a larger carbon footprint than dry powder inhalers, the MedPeds resident clinic at Maine Medical Center led by these all the people listed here are residents at the time, other than Dr. Thomas, Dr. Simmons, who was their mentor. So this was led by Dr. Swee, whose picture is there. And they were able to publish this as a poster on an abstract for the National American Academy of Pediatrics Conference. But they developed a clinic-wide QI project to reduce the carbon footprint of prescribed mirror dose inhalers in favor of dry powder inhalers. They made an infographic, they emailed it weekly, and they created a shared team resource folder with resources. One of the things I heard that were particularly valuable there was payer response and pharmacies, issues with pharmacies, whether they were stocking or not stocking the dry powder inhalers. I should also mention that at this time, and I believe still is, albuterol dry powder inhaler was on the Maine Care formulary, so it presented a really good opportunity to switch patients over, notably patients greater than 12 years old and who otherwise a dry powder inhaler would be appropriate for. I don't have the numbers, unfortunately. I know that they had it was variable month to month, but overall they were able to increase the number of dry powder albuterol and controller inhalers um, um, over the prescriptions of metered dose inhalers. And again, the largest barrier they encountered was not from patients. It was from pharmacies not stocking the medication and having it take time to come in. Next slide. All right, telehealth. So, does telehealth reduce carbon emissions? This is a study from Thiel et al. Looking at telehealth usage at Stanford Healthcare over the years of the pandemic. From 2019 to 2021, clinic visits actually increased 13%, and yet greenhouse gas emissions dropped by a total of 36%, and that was largely due to virtual visits. Can you hit next? And again. So to put in context here, we have greenhouse gases on the y-axis in kilograms of carbon CO2 equivalents. For clinicians, I like to state that kilograms of carbon equivalents is like milligrams of morphine equivalents. It's a way of comparing relative potency. So we put it all in terms of a single gas or carbon dioxide's warming potential. And you can see here the blue is from air travel. It's not that half their patients travel by air, but air travel is particularly carbon intensive. But you can see from 2019 to 2021, the number of total visits, that's the in-person visits, so it's kind of confusing at the top there. But it's not represented here. The total number of visits went up 13%, but the equivalent of emissions from their clinic system-wide, and this is all their outpatient clinics, went down from 4.5 to 2.8 million gallons of gasoline, more or less, equivalents. Now, the critical thinkers here, and we're on this Zoom meeting, and Zoom takes electricity and cameras take electricity. You might think, well, yeah, that's a lot of patients, and they're not driving, but you know, they also had to spend carbon on running the electricity for their high definition cameras and the running the internet and all those things. And so they did include that on this slide. I don't know if you can see it there. Actually, Mike, if you hit next, goes better in person than over Zoom. But they included it there. They had to zoom in because it's so much smaller. So the amount of electricity that they were using on high definition video and audio and running the computers did go up substantially, but it still pales in comparison to the amount that they saved through deferring travel. And you can go ahead and hit next. So a MaineHealth clinical example, and as Mike mentioned earlier, this is something I'm spearheading as the chair of the MaineHealth Medical Group Environmental Sustainability Committee. I highlighted there in pale blue and then again with a traditional yellow highlighter, but our fiscal year scorecard goal has to meet our broader scorecard goal, strategic plan goal of environmental sustainability. So we're in the process of creating a MaineHealth specific virtual care dashboard to measure the miles driven offset by utilizing telehealth, teleconsults, all of that. And then the plan will be for subsequent years to implement quality improvement projects to actually meaningfully in a patient-centered way defer travel through the use of telehealth. So stay tuned on that one. You can go next. All right, hit next like 3 times. Go, go. So yeah, pause here. So patient education. So we know that physicians are concerned about climate change. This is Kocher et al. Since surveys over 4,500 health professionals internationally. Most were attending physicians, most were from Canada, and over 90% agreed at that time that the changing climate was a growing cause of human harm in their local areas, and they felt they had an individual and collective responsibility to educate the public and patients. It's been further demonstrated and looked at and worked with myself and Dr. Gordon that there's a strong feeling among physicians, however, that they don't feel equipped to counsel patients. And this is primarily due to a lack of training and tools and knowledge. They just don't know what to say and they don't know how it's going to be received. Kocher et al. Also reported time constraints, fear of conflict, as other things negatively um, impacting that conversation. At the same time, patients generally report a high level of trust in physicians as a source of environmental health information. Um, but at least in one study, and this was done in as a survey in the waiting room of family medicine clinic in Wisconsin, they reported, and you can hit next twice, preferring to seek out physicians, even though they trusted physicians a lot in these topics, they preferred to only seek them out 6% of the time, as compared to news outlets at 83% and social media at 59% of the time. So physicians, they want, they recognize it's a problem. They want to talk to patients. Patients recognize it's a problem. They trust physicians, but the conversation is not happening. So you can hit next. Oh, yeah, just hit next. So this speaks to research that I do. This is the second round I do in the summer with a Tufts medical student every summer. Um, Lucy Riker-Rich, amazing second-year medical student, presented this work at the Maine Society of Hospital Medicine poster competition last week or a couple weekends ago. And we did a mixed method qualitative research looking at in patients with chronic heart, lung, and renal disease about who, in what format and what information they would want counseling about environmental health for personal health protection around the time of discharge. You hit next. And I just think that this one quote really sums up how we as physicians really need to be better at this. One participant, my primary care doctor knows me the least. I've had specialists for a while. I have a naturopath. She's actually the one who encouraged me, not the pulmonologist, to get a HEPA filter. So, like, right, that's definitely something a pulmonologist should be talking to someone with chronic lung disease about. We need to be better at this. Next slide. Okay, green prescriptions, the last clinical one. Um, so, this part of the talk, this talk in particular is about breadth, not depth. I don't want to go into all the studies. I have the citations here, but suffice it to say, green space, plant forward or plant-based diets, active transportation, and gardening are all things that have been shown to not only have planetary benefits, but also human health benefits. And you can go ahead to the next. So examples of what we're doing at MaineHealth for prescribing green space, just a couple of examples. Walk with a Doc is a national program. We didn't have this until a couple of years ago, and adding it on was part of having more options for green space and active transportation, but green space prescriptions. This is being led by Dr. Jeff Mayer, who's a MaineHealth family medicine physician in Brunswick. Um, Also, Course Storm has several like great activities planned in these realms in general, but this is an active one. Happy Wanderers is a guided hike in the coastal region. Um, and this December, I'm sorry, I don't have the date there, but it's something that patients can find and join. Next slide. Plant forward diets. I'm going to actually hand this one to hand it to you, Mike.
Thanks, Katie. So, plant forward diets is something that in the very first slide I mentioned or second slide, I mentioned how one of the major drivers of climate change and environmental impact is our food systems. And food um, delivers about 30% of global greenhouse gas emissions are due to food systems. So it's something where, again, you can find like kind of that double win where plant-forward foods are lower carbon intensity. They're also known to be better for your health. So in this year, we began a community health implementation plan related to plant-forward foods. So during our I'm sure many of you have heard of the Community Health Needs Assessment or the CHNA. That the During that Community Health Needs Assessment plan, MaineHealth went out to the community, talked to staff, talked to the community members, and identified a lot of areas of opportunity and priorities. One of those is around food. So Colin last week talked about another CHIP, another community health implementation plan related to cardiovascular health and air pollution. We're also focused on developing a strategy to serve more plant-forward foods at our hospitals to reduce greenhouse gas emissions and provide healthier food for our patients and our care team. Back to you, Katie.
I'll go ahead and hit next. I don't have too many more slides. Active transportation, Mike covered a lot of this already. If you go, the big plug here is to go to the sustainability internet if you do work at MaineHealth, and you can find not only about the EV chargers in their location or instructions on how to ride the bus, but also where the bike lockers are located. I also wanted to say for people looking for more prescriptive things I can mention to their patients, the Bike Coalition of Maine has courses for people who maybe want to bike more or they're nervous. And Maine DOT actually has a page on active transportation with some community focused information, different communities in Maine. So those are things you can point your patients to, or potentially even have a bike education clinic come to your clinic parking lot or other place of work. Next. Gardening. So I really wish I live right next or pretty close to the Cape Elizabeth primary care, MaineHealth Cape Elizabeth primary care. And I was kind of hoping that Chris Wellens would be here because they have a vegetable garden that they maintain as a staff next to the parking lot. And I always thought that was really just like nice and welcoming to have patients have that experience on the way in. This is from Penobscot Bay pilot. Periodical about a healing garden at the Waldo Hospital. Just a couple examples. We also have community gardens in the courtyard at MaineHealth, Maine Medical Center. You can go ahead and go for next. Medical education, a lot of the drive to change the way we think about how we can impact greenhouse gas emissions and environmental health has come from the younger generations and especially from the medical students. This article you'll note is from 2020. Medical students putting pressure on medical schools to incorporate this kind of curriculum, and they have their own, professional society, Med Students for a Sustainable Future, and there is a chapter in Maine providing that opportunity for Tufts Maine Track and also for UNE. You can go next. Example at MaineHealth. So this is a really, really, really cool, great, high integrity resource. It's the Planetary Health Report Card that was developed out of, I believe it was Stanford initially. Rigorous, has a really like evidence-based scoring rubric. Started with a few schools and now expanded not only to many, many medical schools internationally, but also dental schools and nursing schools and others. I have here, this is our 2022 to 2023 report card. We got a C grade. You know, I'm pretty type A. C grade, I'm like, oh boy, we can do better. We used a D minus. And the two, what I highlighted there where we got Bs, that is due to the main influence on this report card and the main track students saying that we were doing a better job at environmental health and bringing climate and environment and sustainability into the curriculum we were teaching the students than down at Tufts. So this is really awesome and it's a win. It also gives us somewhere, I mean, this is like a 20-page report, so it gives us a lot of information to change in the future. Next. Quality improvement, and these are a little bit quicker. This I'm doing with a preventive medicine fellow. We're looking at how we're losing inhalers in the hospital, pure waste, not helping patients, educational campaign, technological intervention, OPA, institutional changes, and we've been able so far to save roughly, it's about like $7,000 and about 280 miles driven through no financial investment on the institution. Up in the corner, IHI has a climate and health training module for people who want to do sustainability-based quality improvement projects. So I just wanted to plug that. You can go next. Institutional committee work. Mike spoke to this a little bit. We have a network and we have committees for people who want to stay informed, for people who want to take action. And it is a big part of the culture at MaineHealth and has been, I think, really engaging for people. Um, Yes. Sorry, I just saw your comment, Mike. And then institutional committees, if nothing else, you're already on an institutional committee. I bet you already on some kind of committee. We tend to accumulate those in medicine. So if you can just remember to ask questions, can we reduce low value care, increase educational offerings, track data, track the waste, um, ask like, hey, what is the environmental impact of like, say, heparin, which comes from pigs, like just bringing up the question. You can help make changes. And if you hit next again and then build towards larger things like the Joint Commission Sustainability Certification, which has been in existence now for a few years. And if you hit next one more time. And then lastly, advocacy, which of course is outside of the realm of our everyday jobs as physicians, but still is super important. I just want to give you a little homework here for those. I appreciate you if you're still on the call because I know we're going long. But if you can forward our next newsletter to 3 people in your network, I think that's an amazing thing to do to help amplify that this is important, but also help when, legislative need comes for more voices and attention later, that will be a way that that can be communicated to people. So that was my last slide. And apologies for going long. I think part of it's because my voice is barely working. Would anyone have any questions?
Thank you. A huge thank you to you, Katie, and to Mike. I unfortunately I don't think we have time for questions. We're over. There were some in the chat, and if either of you had time to answer those separately, if people want to stay on, if they have questions for a minute or two. But your work shows what's possible when health professionals lead the way, both in science, policy, and heart, and gives us all a concrete way to step up in our own settings to further the goals of planet sustainability as well as patient health. I just want to remind anybody left on that you can get CME credit by filling out the evaluation form, which will come to you when you close out. And unfortunately, I do think we have to close out. So thank you again, Katie, Mike, everybody on for your time, your expertise, your leadership in making Maine's healthcare sector healthier, cleaner, more resilient. And thank you all for spending time with us. Don't forget to fill out the evaluation. We need it, and you need it for CMEs. So thank you very, very much. And Katie, I hope you feel better.
Thank you.
Thanks, everybody. Have a good day.
Thank you. Bye.
Thanks, everybody.